When it comes to insurance, open enrollment is about to end. What do you do if you miss your enrollment period? Here with the answers is Chris Carruthers. He's the president of your insurance agency, and Dr. Linda Johnson from P3 Whitney Ranch. Welcome, you two.
Thank you.
Hello.
How does someone decide or figure out which Medicare plan is best for them?
Well, with 36 plans here in Clark County to choose from.
Okay, start with plan number one. Okay.
It's going to take some time. So really, it takes time. I would start with first making sure your doctors that you would like to see are part of the plan, and also your medications. A lot of the plans have very low cost premiums, have a lot of the extra benefits we all hear about. Right. The issue is that how are my providers? Do I have access to the providers that I want to see?
Dr. Linda, how do you know if you have a good plan? So if you have a plan right now that you like, I mean, what are some signs that that plan is working for you?
So I think part of it, between me and the patient is, does it have the medicines you need? So the medicines I'm trying to prescribe, does it not have them or doesn't have them? Can I get you to the specialist that you need to see? So if you're able to get the medicines you need and see the doctors you need, you're on a pretty good plan.
Yeah.
What is OEP?
OEP is something new. It started beginning of this year. It stands for Open Enrollment Period. So most of us are familiar with AEP, Annual Election Period, which starts October 15th and ends this Saturday, December 7th.
It's go time then.
So we have a new OEP, Open Enrollment, that goes from January 1st to March 31st. It's something that we're not allowed to market. We're not allowed to run commercials anymore. It's something that consumers have to come to us, and we can help them move to a new plan, because a lot of times you wake up January 1st, you call to have an appointment with your doctor, and you find out your doctor's no longer with that plan. Sometimes you find your medications are not covered. Maybe you missed open enrollment, you're out of the country for whatever reason. Next thing you know, here's this opportunity to make a switch if need be.
So if you're kind of maybe even sleeping on the whole enrollment thing, and next thing you know, it's Christmas morning, like, oh, I know I forgot to do something, I didn't sign up. This is kind of your grace period to get locked in.
Correct.
And then if you do sign up, as you're saying, if you start with your new plan, you're not happy with anything, you can switch it out?
Yes.
How much does Medicare cost when it comes to Medicare? Can you ballpark some cost?
Medicare, in the sense of the Medicare itself, is fairly inexpensive. You just, all the years you worked, you pay for Part A of Medicare. You just go by Part B, which is right now currently $135.50, which is going up next year a little bit. But other than that, these plans, a lot of the plans we're talking about, that even Dr. Johnson represents, they have zero plan premiums.
Now, you said there's how many plans to choose from? 36. 36. Dr. Linda, is there a plan that you prefer as a doctor, or you're just happy to see your patients come in? Well, am I not allowed to ask you that question?
Not really, and I honestly don't prefer one over another. For me, it's individualized for the patient, and that's where it's so important to work with a broker, because every patient has different needs. So I want to make sure that they get the plan that's right for them. So.
And if you have that doctor now that you just love, and to me, once you find that doctor that provides that amazing care that you guys do, it's all about just finding the plan that continues that doctor.
And we take several. Of those 36, we take nearly half of them. So.
And let's talk about deadlines. What are some of the deadlines we're looking at?
So you got December 7th, this Saturday.
Saturday, it's coming up fast,
right? That's for Medicare. Then we have another open enrollment, which is for anyone that's under 65. So those individuals that don't have insurance through work, if you'd like to sign up for a health plan through Nevada Health Link and get subsidies, or buy a plan on your own, that's December 15th.
Okay, so these deadlines are fast and rolling. Thank you so much. It's always so informative when you stop by. I really appreciate it.
Thank you.
All right, so open enrollment, it ends December 7th, as we said, for Medicare, and December 15th for those under 65. For information, visit yialv.com/locations.